It's a huge pleasure to introduce our second plenary speaker, Professor Leo Ford. Professor Ford is a Priestley Chair in Climate and Health at the Priestley International Centre for Climate and an expert in climate change impacts on health. She is jointly based at the School of Earth and Environment and the Nuffield Centre for Global Health and Development at the University of Leeds. She's a lead author on the recently released Intergovernment Panel on Climate Change, and she leads international multidisciplinary projects on indigenous adaptation to health effects of climate change alongside partners in Uganda, Peru, and the Canadian Arctic. Today, she will be talking to us about what to expect in a changing climate, public health in an era of warming and decarbonisation. Thank you very much.
Thank you. It's a pleasure to be here and a hard act to follow. So yes, what I'd like to do today, this is not a research talk. This is really to give you a broad forward look about what we can expect in terms of climate change projections and scenarios, and what this means for the changing landscape of public health in the UK. I just this week have moved fully, I was doing a secondment, have moved fully to my role as heading the UK Health Security Agency's Centre for Climate and Health Security. So climate change is affecting health now. This is not a future risk. I'll give you a couple examples. This is one. UK summer 2022, many of you will remember, we reached for the first time over 40 degrees in the UK. This was a major heat wave. Many of us found this actually quite pleasant. In fact, however, for those who are highly vulnerable to shifts in temperature, particularly those who are older or have comorbidities, this can actually be quite dangerous. That summer, that heat wave resulted in 3,000 excess deaths that can be statistically attributed to heat, which is double the historic average. Pakistan, 2022, 1,700 deaths, 12,000 injuries, and 33 million people affected. Also the worst malaria outbreak in the country since 1973. Many of you will also remember the scenes of this really quite catastrophic flooding. Greece and other parts of Europe, this summer 2023, this was the hottest July in Greece in 50 years, the longest ever heat wave, and the single largest wildfire recorded in the EU. So this led to over 20 deaths in this case. A little less obvious, this is actually my local Tesco, I believe it was, winter 2023, empty produce shelves. And actually they had this sign, which I thought was quite interesting: sorry, due to adverse weather conditions, these products are out of stock. So this is a really good example of the more indirect, complex implications that climate can have for health. In this case, climate implications, adverse weather conditions, drought in the countries that supply food to the UK caused food disruptions of fresh produce in the UK, and many shelves were empty and some stores rationed purchasing of food. Excuse me. So these are just 4 examples of how we're experiencing on the ground some of the implications of climate change for health. And while this last one spoke a little bit to the indirect impacts of climate change on health, some of the most significant implications will be those that are a little more complex and harder to see, where we see cascading and compound effects of climate, and where climate change affects the determinants of health. And so an example, sort of speaking to one of the questions earlier for Professor Kelly, we're actually finding links between climate change, for example, and AMR, antimicrobial resistance, with climate change and heat having the potential to increase the rate of antimicrobial resistance development among a range of other linkages and connections. And we have a paper out, one paper out, and several more on the way, speaking to the links of climate change and AMR. And so that's just one example of really this sort of web of implications. But it will be climate change impacts on the determinants of health that may be the most significant. And so we'll see, and I'll talk about this a little bit later, implications for mental health, for climate-induced migration, et cetera. So what can we expect over the next 50 plus years, so through to the end of the century? We're likely on track for average global warming of about 2 to 3 degrees. Right now we're just under 1.5. These are averages over quite a period of time. And we're predicted to surpass this 1.5 degree target that we've had internationally, probably sometime in the mid 2030s, which isn't that far away, until about mid-century. The trajectory of warming is relatively predictable because it's largely based on past emissions. And this is because there's a real time lag in the climate system. And so the figure on the top, what you can see is all of the possible future scenarios of emissions of greenhouse gases. And those green lines are the ones that are consistent with a 1.5 degree average warming world. So those are the sort of optimistic scenarios. And on the bottom, you can see what that means for global temperature increases. And the key here is the lag effect. So even if we were to hit net zero tomorrow, we would still see warming till about mid-century. So we're locked in. We're locked into some level of warming. About mid-century onwards, that's where there's uncertainty. That's where there's different worlds. Things could either get better and even start to come back and cool back, or they could get worse. And some of those predictions are catastrophic. And it's actually the decisions that we make today that will decide what happens in the second half of the century. And so I just sort of wanted to highlight the importance of thinking temporally about climate impacts. And I'll talk a little bit about what this means generationally in terms of generational inequities a little bit later. So some examples of impacts. It's nice, actually, I don't talk about air quality, so these are sort of other impacts other than air quality. So I'll speak to two of these. The first is on vector-borne disease. This here is our friend Aedes albopictus, sometimes known as the Asian tiger mosquito, which is, as you can see on the figures on the left, if you just focus on the red, which is where this mosquito is established, you can see that it's marching northwards and it's coming our way. It will enter the UK. It's just a matter of when, how much we can delay it, and how much we can control it. It's an incredibly, it's a real nuisance mosquito, which is sort of nuisance is such a soft word. This is the mosquito one of the mosquitoes that determines whether or not societies build houses with screens on all the doors and windows, for example. So nuisance is quite a significant implication. But also the reason we worry about this and are interested is because this mosquito is a vector for dengue, Zika, and chikungunya. The UK has historically been too cold for survival of this mosquito, but we're increasingly have suitable conditions, particularly in the south and in London. And we have seen, my team does the vector-borne disease surveillance in the UK, and we have seen just a few mosquitoes showing up that we're able to suppress. So this is on the horizon. Both mosquitoes and in some cases pathogens can be climate sensitive. Yeah, all right. This is on its way. Heat. Let's talk a little bit about heat, particularly this question that people have, legitimate question, We may have sort of more deaths or more risk to heat, but won't that be compensated by kind of lower risk due to less cold? So this comes from recently, 2023, published report by UKHSA on the health effects of climate change. I'll walk you through it. If you look at the figure on the left, the red bars, these show projections of increases in heat mortality over time. So the baseline is around sort of 1600. This is our average at the moment. This is what I compared to that 3,000 that we had during the heat wave. Moving up to over 10,000 mid-century, and then over 20,000 near the end of the century. These are pretty big numbers. This is quite significant increases. This is a reasonable worst case scenario. So this is hopefully not the direction we're going, but reasonable worst case scenario. So significant increase in heat-related deaths we can anticipate without substantive intervention. Is this compensated by decrease in cold-related deaths? Well, if you look at the graph in the middle, those are deaths related to extreme cold. We do see a little bit of an increase starting in the latter half of the century, but that's actually not where most of our deaths come from. Most of our deaths due to cold come from moderate cold, and you can see now and till the end of the century, moderate cold will be the dominant contributor to temperature-related deaths. And that doesn't really start to decrease until a little bit late century. And so what we're going to see is increasing heat-related deaths and increasing cold-related deaths at the same time. And the reason for that is because the majority of our temperature-related deaths are in people over 65. And we, as a demographic population, are aging into a more vulnerable state. So it's aging in demographics that will mean that we will have more heat-related and more cold-related deaths because age determines both. I want to talk a little bit about generational equity. So this is a graph from the IPCC, the Intergovernmental Panel on Climate Change's 6th assessment report, on which I was a lead author. This is the sort of global reports that assemble all the science on climate change, and they are put out about once every 5 years. On the top, you can see essentially the change in temperature, global average temperature over time. And when you hit that black line, there's multiple different scenarios, multiple different futures, going from continuing to get very hot to kind of stabilizing at higher temperatures. And on the bottom, you can see these kind of imagined generations. So if you're like me and you were born in maybe the sort of 1970s or between the 50s and the 80s, there's a good chance we will be in our retirement years around mid-century. So I will be hopefully in my retirement years, and we will be the vulnerable older people when it gets hot. Potentially, in a best case scenario world, we will be the vulnerable older people during peak warming. A child born today or in the 2020s will be born into a world of climate change. They will be the working age folks supporting us, the older folks, the older vulnerable folks during potentially peak warming, or not. Okay? In a best case scenario, that's peak warming. In a worst case scenario, things get worse for them. So my children and my grandchildren will either see things get better, okay, or see things get catastrophically worse. So the reason I mention this is because I think it's really important to understand how different generations are going to experience across the life course the implications of climate change. And this has become a generational equity issue. And when you look at this, you begin to understand some of the emerging science that tells us that there are significant mental health implications in youth due to climate anxiety, to the extent that we're seeing youth making different reproductive decisions. And that seems a little less irrational when you think about different generational experiences. So what does this mean for, causing damage up here. What does this mean for physicians? For those working directly with patients, you will probably see more heat-related illness and risk. So things like social prescribing to keep cool, we may see that. We may already be seeing that, actually. Change in our differential diagnoses for infectious disease, so those we previously thought to be tropical may no longer require evidence of travel. Dengue in London will be something you may experience or see or deal with in your career. We'll probably see an increase in climate anxiety in youth and mental health implications of that will need to be taken seriously. Particularly vulnerable to flooding are farmers and rural populations, where we're seeing sort of a real cluster of mental health implications, including increased suicide related to flooding, also eventually drought, and these are also in many cases some of the populations who are least likely to seek health care. And migration, climate will increasingly have an impact on migration. There are some countries that are already negotiating with other countries to reallocate the entire population. So these are small island states that will be submerged. I mean, that's a dramatic example, but we will begin to see increasingly climate-induced migration. So now that I've gone through all this doom and gloom, I want to talk a little bit about opportunities. Climate change has been referred to, and actually I think Professor Kelly put up that slide, as the greatest threat to health this century. It's also been referred to, I think it was the follow-up report, to potentially the greatest opportunity for health this century. And part of that is because a lot of the changes that we might want to make, a lot of the interventions that are good for climate, both reducing emissions and slowing climate warming, as well as building resilience to impacts of climate change, are already good for health in the first place. And this is what we would consider win-wins, or we call co-benefits. So these are sort of no risk interventions. And it didn't need to be this way. This is quite serendipitous. There are a number of co-benefits. And the ones that I want to flag, those that probably have sort of the strongest win-win potentials, are typically related to diet. Okay, healthy diets are often low-carbon diets. Not exclusively, but there's quite significant overlap. Exercise, okay, a lot of the more healthy exercise are being involved in more what's particularly active transport. It tends to have lower emissions, tends to be healthier, and green space. So green space, green roofs, green areas that can provide shading, improved mental health, and reduced emissions. So these tend to, in our research, rise as sort of the three main categories. There's also a lot we can do simply to adapt. Something that is not allowed currently in the UK, but would probably be quite helpful and effective in areas that get heat, is to have shutters on windows so we can actually block out the heat. So changes to the way that we build our homes will be quite important. And the medical and health community can play a really big role in being a voice for health in some of these decisions in this arena around housing, changes in house building, land use planning, et cetera. And so we do often hear folks say, if we had data or if we had a voice from the health community, that has real impact. It's a sort of a real lever into some of these discussions. So I'd like to end with what my center, this new Centre for Climate and Health Security within the UK Health Security Agency, what we are doing. So we deal with adverse weather and health planning, and so this is guidance to public health organizations about what to do to prepare for and build resilience for adverse weather. We do national surveillance for vector-borne diseases, national surveillance and response. We have teams going out trapping mosquitoes, ticks, responding to different events as they occur. Quite an active space, quite a lot of entomologists out there, particularly on the southern border. We are engaged in a wide range of research with different research partners. I think I saw an HPRU, Health Protection Unit, link in Professor Kelly's presentation. We inform the National Adaptation Plan. So there are statutory requirements under the Climate Change Act for us to prepare for the climate impacts on health. And so we publish a number of reports. Coming out this year will be a special report on climate change and mental health. We also train a large number of public health registrars. We're a national training hub for that. And we've got a digital portal which we're slowly building toolkits and evidence on, and you can see that on the bottom. But perhaps most importantly, and I will end with this, is the role of the center that I lead is really to move us from paralysis to pragmatism and to really give a sense of hope. So what is a vision for a well-adapted future? We often have a lot of scenarios of the doom and gloom of the future, but what is a vision for a positive future? And I will end there.